Hello, I'm Jonathon Collopy, and I'm an executive director with the YMCA of San Diego County. And this is the Why Be Well podcast. Thanks for joining us. Today, I am honored to have Dr. Brett Parks, a dentist, with us in a conversation that we haven't had before on the Why Be Well podcast. The topic: Grin and Thrive, oral health and wellness. So we're really going to talk about how dental hygiene can affect our overall sense of well-being. So Dr. Parks, welcome.
Yeah, thank you so much for having me. I am really honored to be on the podcast and thrilled to be talking about how oral health and prevention of oral diseases can promote overall health and overall wellness.
Well, I look forward to learning a lot about this particular topic. I do want to kind of qualify your background, Dr. Parks. You're currently working at a nonprofit, the San Diego Family Care, as a pediatric dentist. You're also on staff at Rady Children's Hospital, and you are the proprietor of Parks Pediatric Dentistry in Point Loma, in our hood over here. So thank you for all that you're doing in the community, especially supporting youth and families with dentistry. So our topic, grin and thrive. I actually had to look up the word grin because I don't use that typically in my narrative, but grin is like smiling broadly, and you express that so well just in your natural posture there. So tell us a little bit about why grin and thrive are related, so to speak.
Yeah, I love this topic, especially because my background is a very scientific background, attending UC San Diego, doing biochemistry studies, and then got my dental degree at UC San Francisco, which is a big research university. And in those institutions, we really learned to integrate whole health and science into the studies of the body and ultimately dentistry. And now more than ever, there's an understanding of the connection between the health of the mouth and the health of our whole system. Just to paint a pretty uh, helpful picture, I think, is to remember how everything that passes through our mouth then enters the body, and that track from our mouth, our teeth, our gums, our mucosal tissues, all tracks down into our GI system. The mouth is innervated by so many nerves. The blood vessels go from the heart to the mouth so quickly. It makes a lot of sense that the health of the mouth would be connected to the health of our overall body.
Hey, it's a great point, Dr. Parks, because I hear more and more conversation in the well-being sphere about gut health. There's a lot of focus on gut health, and obviously that it has to get to the gut somehow. So to your point, that connection between oral health and overall well-being. And what I appreciate is a lot of medicine seems to have become so specialized, yet there is also the awareness at the same time of one being, or overall the oneness of us, and so how everything is interconnected. So if you will, kind of take us through that connection between, as you say, the oral cavity and our overall body.
Yeah, one thing to remember is that we are a body, but we also have a microbiome. And that's the concept where we have a relationship with bacterial organisms, microorganisms, and they will reside in our mouths and also in our gut. They reside on our skin and in most of our systems. And so when we talk about things like inflammation, generalized inflammation in our joints, or gut health and inflammation, we're talking about these systems in our bodies that are interacting with our microbiome, with our immune response. And so when we think about it, one of the most common diseases of the mouth is gum inflammation.
Mm.
It would make sense if we're thinking about gum inflammation as a disease that would be correlated with poor or adverse outcomes in heart disease, coronary artery stenosis, inflammation of um, the lining of the GI system. It's all connected. And so trying to make sure that our mouths are healthy will make sure that our other systems are healthy as well. I was recently reading a study that was talking about mental health and gum health. And it didn't have a cause and effect, but it said that mental health and stress was almost 40% increased risk for someone who had gum inflammation. And that's partially because the gum inflammation is releasing those inflammatory markers into our body, and it's messing with the serotonin or dopamine in our body, and those help regulate our mental health. And so we're learning more and more how connected it is.
That's fascinating. I know inflammation is also, there's much greater awareness of the disease factors with inflammation. And so obviously foods, depending on what foods you're eating, that can feed into inflammation. So when you talk about gum health, what does that mean to you as an expert in that area?
Yeah, so gum health is really going back to that idea of the microbiome. We have these organisms in our body and they reside with us, and most of them are actually really healthy and helpful microorganisms.
Hmm.
But what is happening in our gums in those areas is there's a competition between the more pathogenic microbiome or microbes and the healthy or commensal microbiome or microbes. And so anytime that that scale is tilted in a way towards unhealth, we get an overpopulation of these more pathogenic bacterial species. And that's when you see inflammation or you see loss of bone structure. These pathogens have actually been tied to if there's a increase in the number of them in your gum biofilm, then there's some of them that will be increased in even Alzheimer's patients in the brain, and there'll be a higher prevalence or a more severe Alzheimer's or dementia outcome in adults that have really severe periodontal or gum disease.
Interesting. Is that due to foods that we're eating? Is that due primarily to care or not care maintenance of our gums?
Yeah, that's a wonderful question, and I will say it's both.
Okay.
Now, being a pediatric practitioner, my specialty focuses a lot on growth and development, and
Mm.
that's where I really got interested in where the oral health is tied to our whole health because I see, newborn babies sometimes in my practice, and then I'll see even, adolescents into adulthood, and they're growing, and so their health is very much affected with their diet,
Mm.
eating things that are inflammatory or high in sugars, and then as we mature in age, the routines of prevention with flossing, with regular brushing, um, and then with our regular checkups with the practitioners, those are very correlated with healthier mouths. Is the regular check-ins and the brushing and flossing. Yeah. So it's a both and, right?
Yes, no, it is. It's interesting. You alluded to something earlier about the connection between the mouth and the heart and heart disease and whatnot. And obviously, you're speaking to there's a blood supply there from the mouth to the brain, I would assume, to the heart. Help me understand that in terms of oral care.
Yeah, so I think even just framing it in pictorially is helpful for me sometimes. And so when you think about your heart and the way that the major blood vessels, as your heart pumps, pushes the blood to the rest of your body. The one of the main branches off of the heart is the aorta, and the aorta has some first branches. Some of those branches are headed to our extremities, but the immediate branches off the aorta actually go into the carotids, and those almost immediately go to your mouth. And so the blood supply to your mouth is, very close to your heart. And then as the blood drains to the venous system, it drains lastly from your brain and then goes right through the mouth area to the heart in the jugular vein. And so I do think it's if you think about proximity to pathogens and how those pathogens from your mouth can travel, it makes sense when you think of how close it is. Now, I see a lot of young patients at my practice who need care through Rady's children's, and sometimes before we even brush their teeth in the office, we need to give them antibiotics because if we stir up the bacteria in the mouth and they have a congenital heart diagnosis, then the bacteria can go to the valves that are malfunctioning in their heart and cause a very serious, heart infection. And so that's an extreme example of the way where gum bacterial populations can cause really serious acute problems. But as you can imagine, over a lifetime, as we think about our older patients, they can just build up and build up and build up and cause more issues.
So that's the consequence of. How about prevention? How do we go about providing a healthy foundation for oral health?
The biggest thing I like to emphasize is trying to maintain that healthy balance of those competing bacterial populations. And so, what we're really trying to do is to give the good bacteria a good home to live in
Mm,
and trying to take away the things that the bad bacteria want.
mm.
And those bad bacteria or pathogenic bacteria, they want to not be moved. They want to hang out. And so they don't want to be brushed or, had a professional cleaning. They don't want to be flossed. And they really want foods that help them metabolize and grow and populate. And so those high sugar foods or dense carbohydrates that are easily broken down, those are their favorite, especially when we're speaking of cavities. And so we can eat less of the foods, or we could remove the foods, and it's a combination.
So those unhealthy ones like to set up camp and hang out there for as long as they can.
Yes, they do.
So what are like routines? I mean, you often hear about flossing and brushing after meals. I'd love to hear from you specifically. What would be a healthy routine, especially because you have the ability to start at a young age supporting youth and developing and integrating and conditioning a regular practice?
Yeah, I think perhaps I'll answer this question a little bit different than what would be expected. But for me, really, maintaining an active lifestyle is very much at a foundation for maintaining health when we think about even the mouth. I truly believe having a active routine helps everyone then maintain other routines in their life that can contribute to health. And so perhaps you would expect, yes, brushing our teeth twice daily, morning and night, making sure that we are flossing. Those are definitely cores. And I don't know if we get to those regular healthy routines without having an integrated, healthful life. And so I think, yeah, eating healthier foods, we're more likely to partake in that when we're also partaking in activities throughout the day that are getting our body moving. And those healthy foods, again, I think are just as important at keeping our mouth healthy as brushing our teeth. And so, yeah, I know this may be a little bit
No,
of a different answer, but
I appreciate that. That's a different different take or orientation. Obviously, it goes back to kind of overall health and well-being. And I love your point of if you're active, healthy in other aspects of life, you're most likely going to integrate this area of oral health through certain practices of brushing and flossing.
yeah, and I think it does take, especially in my field as I work with kids, it takes a lot of discipline for our parents to be be healthy with their routines and able to and enabling their children to be healthy with theirs because even to age 7 years old, parental engagement in brushing has to be there. Making sure that the parents are actually flossing for for their 7 year olds, that's very important. And in order to get there, I think parents also need to be, having those routines for themselves. And so it's not, I honestly, it's not an easy thing, I don't think, to making sure. I have two young kids and making sure we floss every night, and it's sometimes a battle. And there's regular discipline that has been built up in my own routines that I think enables me to maintain health for them too, if that makes sense.
No, it's a great point, Dr. Parks, in terms of as parents or any kind of a role model, what you're modeling for your children or for the youth shows that priority. You're investing time and energy, and so that example is critically important. You had spoken when we were offline talking about there was some community benefits that are related to oral health. What does that mean?
Yeah, I think that um, this is something I'm quite passionate about working in public health. When we are engaged in keeping our mouths healthy and preventing dental disease, our whole community benefits. And what that really boils down to is when we are preventing needing for emergency treatment for cavities or infections, we are decreasing the economic burden of those treatment outcomes on the on honestly society as a whole. Every time I need to make an appointment for my kiddo to have fillings, those are days that I need to take time off of work. And those are also days that our kiddos are missing time in school. And so when we think about, yeah, they're going to have to miss time for school for their preventative visits, it ultimately saves a lot in the terms of social safety net, ensuring the everyone has access to care. There's a lot of economic and public health benefits of prevention specifically. I did have a stat that I read earlier. It said 30, this is from the WHO, 34 million school hours are lost each year because of emergency dental care.
Hmm.
And that's about $45 billion in productivity due to
Wow,
untreated dental disease.
wow, staggering.
And so those are staggering, those are big
Yeah.
numbers, but I think um, zooming it down, there are people that don't have their sick time. They don't have, or kiddos that need to be in school, and trying to emphasize prevention and education, it really goes so much farther than we give it credit for.
Great point. If I could, I want to take you to the other continuum of life. Our focus has been in somewhat on pediatrics and youth. What about those that are in an aging population and in oral health?
Yeah, I think that touching back on the idea that our general body inflammation is correlated with the inflammation of our mouth is something that can perhaps ground us and remind us of the importance of maintaining that, you know, that bacteria that is less damaging in the mouth of our aging population. Um, Having less inflammation in the gums or less of those pathogenic bacteria is correlated with better outcomes when we're speaking of patients with dementia
Mm.
and Alzheimer's. we also, when you think about chronic diseases of an aging population, diabetes is often something that is diagnosed. And having the whole body be influenced by the healing or lack of healing ability from a diabetes diagnosis, the oral health outcomes, the bone loss, the early tooth loss at an advanced age,
Mm.
those diagnoses go up. And so, trying to make sure that our mouth is healthy can make our A1C numbers better.
Mm.
All of these things is connected to our whole body feeling being healed. So, adults at advanced ages lose their teeth, but adults with 20 or more teeth after the age of 60, 70, they have much greater life expectancy than their peers who have less than 20 teeth. Um, and so that's very telling.
That's great information. It sounds like there's a good body of research that we're continuing to gain. Any different approaches, technologies, interventions that we should know of that are on the horizon or being enacted that maybe the general public we don't know?
Yeah, for pediatrics, there's always some really exciting things moving into our field.
Mm.
Um, but for everyone too, some of the technology that's being implemented with X-rays, which help us diagnose bone loss and diagnose cavities,
Mm.
using new AI models is
Mm.
actually really exciting for me. Um, in my practice, we use an AI, it's called Second Opinion, and we can overlay the AI analysis on our X-ray, and it will show the parents the anatomy of each structure,
Mm.
and it'll also then point out any areas of disease,
Mm.
and it also gives depth and probabilities of the disease expanding or causing issues.
Fantastic.
It also, in the adult population, will measure bone loss and show progression of disease. So that's something that's been exciting to me. Um, and then on the public health front, I think that a more integrated health system in treating the mouth and the whole body,
Mm.
I think we're close, and
Mm.
it's there's a lot of our my colleagues in dentistry who are really engaged on the topic of trying to be more collaborative with our physician colleagues, um, and working with insurers too. It's a group project like in high school. We're all trying to figure out how to get this project across. So I think that there's good, hopeful things that will happen in the prevention, public health landscape too.
That's wonderful. It sounds very promising, especially as you talk about those AI models, which allow for earlier detection, earlier empowering people for prevention. One of the things I like to do with all of our guests on the YV Well is an opportunity, as you're talking about whole body health. I like to learn from each guest what might be their well being practice that is critical or important to them so that maybe we can learn from different experts in how they go about their daily life.
Hmm. Um, yes, I love that question. For myself, I'm sure that yourself and the listeners can tell there's daily practices that I put into place. One, because I have a chronic injury in my back. And
Mm.
so for me, every morning I have to wake up right around 4:30 or so, and I have to do my physical therapy and my stretching. I'm a frequent YMCA member. I'll
Yes,
always
thank
be
you.
over there they open up at 5 a.m. and I'm walking through the door.
Nice.
Um, so that's definitely a part of it. Also, I incorporate in those mornings a time of silence and prayer
Mm.
and meditation too. And I think that goes along with what even we touched on with mental health being
Yeah.
so important, and emotional, spiritual, physical health.
Mm.
And so those daily routines are helpful, not just for my back, but I think they make me a better husband, a better dad, and a better doctor for my patients. And so
Uh, yeah,
I love it.
that's beautiful. I really appreciate you sharing that. Our time is coming to a close, Dr. Parks. Any last notes?
Um, I'm just thankful that we had this time to talk. And I just want to engage in the listeners in just keeping their mouth healthy and not forgetting how correlated their mouth health is with their whole body, and engaging with their own providers to have that conversation too, because I'm sure that their personal doctor would love to keep this conversation going.
That's fantastic. Dr. Parks, thank you for offering your expertise to all of us, and we'll spread the word. So thank you for your time today.
Yeah, of course. Thank you, Jonathan. It was a wonderful talking.
And to all of our guests and listeners, until we have the opportunity to be together again, please be well.